Dr. Nath Mukherjee from Calcutta. I am an MD medicine. So today I am going to discuss about high blood pressure. It is very common name in the medical practices, but today's discussion will be on what is high blood pressure, is and how to prevent it. Generally, everyone would like to have healthy and normal blood pressure, but what exactly the blood pressure means? Basically, each time when the heart beats, it pumps out blood into the blood vessels. This creates a pressure against the walls of the vessels. This is called blood pressure. Normally, a healthy person, it rises and falls throughout the day. But when the blood pressure remains high for a longer time and left untreated, it can lead to serious health complications. In general, persistent increase in blood pressure higher than the normal level is known as hypertension. So what are the risk factors for having high blood pressure? So age is one of the very important risk factors. When the age increases, there is chances of high blood pressure because the blood vessels get stiffened up. If there is a family history of near one, like your brother, mother, or father have a high blood pressure, there is a high chance that you will have high blood pressure. Excess of salt intake while taking food, if you used to take excess of salt, then there is a very high chance of high blood pressure. Not eating good amount of food containing high potassium level. I will discuss later on what are the foods with the high potassium level. Eating processed food. This is very important. Nowadays, you can order any food from your phone, and if you eat processed foods regularly, that is one of the very important cause of high blood pressure. So try to avoid the processed food. Another issue is reacting to the stress. So nowadays, every people are on stress. They are working day and night. So if you have any stress, so try to manage it, and how to manage it, I will discuss later on. So the stress is one of the very major important factor of high blood pressure. Moving on, the hypertension doesn't have any symptoms. The patient will have no symptoms. He will find, I am a healthy person, but his blood pressure might be very high because it doesn't create any problem in the patient because it doesn't cause any like pain, headache, or something like that. So we call it a silent killer. Hence, the early accurate diagnosis is very important. Though there are certain, minimal symptoms are there, like morning headaches, tiredness, changes in visions, and sometimes fatigue, nausea, vomiting, and all this. But these are not very significant one, and it doesn't mean that you have high blood pressure, but it may cause all these symptoms. So the important factor is to check your blood pressure after a certain age. Like in the younger age, it should be around 18 to 20 years. And after that, at least yearly, you should check your blood pressure. That is also very important. Now, what is the normal blood pressure? So normal blood pressure is 120 by 80 millimeter. Why we call it 120 and 80? What is the nomenclature? Means the first term 120 is the systolic blood pressure, and we express it in the millimeter of mercury. So 120 is the upper limit of a systolic blood pressure, and 80 is the upper limit of diastolic blood pressure. So when we call it a hypertensive, when we call it you are a hypertension, when the blood pressure, the systolic one is above 140 or 140, at or above 140, and the diastolic blood pressure is 90 or above. So when the blood pressure recording in two instances, if it is 140 or above systolic and 90 or above diastolic, we call it that you are a hypertensive patient. Now, Then if you are diagnosed high blood pressure, now how will you manage? How the doctors try to manage, how you yourself try to manage? The first is not the medication. If the blood pressure is very high, you have to take medication. If it is near the higher limit of normal, like 140/90, you can try the other methods. And these methods are regular exercises. You have to go for a regular exercises, then healthy diets. One important factor is quit smoking, quit alcohol, excess alcohol, regular blood pressure monitoring, stress management, and adherence to the medicine if you are prescribed medicine. So regular exercise is one of the very easiest way to reduce your blood pressure. Yes, exercise reduces blood pressure. Walking is a very good exercise. You can go for yogas. Walking at least for around 40 minutes. You have to walk for around 4 kilometers in 40 minutes. Quite brisk walking. So it should be a regular one. And check your blood pressure regularly. Now, the regular exercise also helps you to maintain healthy weight. That is also very important, which is, in my opinion, is an important way to control your blood pressure. At least 30 minutes or aerobic exercises, walking is very good. Swimming, jogging, all these are very good exercises. What is a healthy diet next? So diet is very important, one of the very important factor of managing high blood pressure. There are several diet regimes are there. One of them is DASH or Mediterranean diet, eating less saturated fats. You will find it in the books or in the websites. What are the foods which are high in saturated fats? Plenty of potassium you have to take. Limitation of amount of sodium, like in salt. Salt contains a lot of sodium. So what is DASH? DASH stands for, a dietary approach to stop hypertension. This is called DASH. So in the European country, on the Mediterranean country, it shows that if you have in a DASH diet, the systolic blood pressure reduces at around 11 millimeter of mercury. So this is a good amount of reduction. Now sodium. Sodium means salt. You should take very reduced amount of salt while you are eating food. So it can also reduce your blood pressure, systolic blood pressure, for around 5 to 6 millimeter of mercury. What are the foods which contains high salt? Ready to food levels. The ready to food, all these contains high sodium. Processed food, only small amount of sodium occurs naturally in the food, but sodium is added during processing. That is also very bad. And if you add salt while you are eating, like 1 tablespoon of salt contain around 2,300 milligram of sodium. So it is quite high. Next is you have to quit smoking. Smoking is very bad for high blood pressure, for any reason, like for heart and for high blood pressure. If you smoke, transiently there is a very high rise of blood pressure that can cause stroke, myocardial infarctions, or kidney problem, and it carries all other risk factors with the cancers and all this. So one of the very important things while you are trying to manage your high blood pressure is you have to quit smoking. Next is excess of alcohol. So the minimum alcohol is okay, but if you take excess of alcohol, that is also very bad. And next is regular blood pressure monitoring. So it is the few things people do. They check their blood pressure with the medicine or without the medicine. And feels like I'm feeling fine, my blood pressure was fine, so no need to worry. But after 1 year or 1.5 years, you are also feeling fine, but transiently there is a rise of blood pressure. So the regular checkup of blood pressure is very important. Even those who are on medication, you should check your blood pressure either in the clinic or at your home. So home blood pressure monitoring is also very important, and it doesn't matter if you buy a small BP instrument from the shop and check your blood pressure regularly, either in the morning or in the evening. That is good enough. If you see it is normal, fine. If it is high, you have to visit the doctor. So self-monitoring of blood pressure also is very important, because when you are going to clinic, you might have a high blood pressure because of the stress of going there, you are seeing your doctor. So regular home monitoring of blood pressure is also very important in managing high blood pressure. So the self-monitoring is also very important. At different times throughout the day, you can check, you can write it down, and you can consult your doctor with that booklets that I have this kind of blood pressure at different time of my day, and the doctor will judge which medicine you have to give, which medicine they will give to you at which time. So that is also very important for the doctors as well as for your treatment. So it also helps to better prediction of all the cardiac or the cerebral problem you will face later on. So the control of blood pressure is very important. Now the stress management. How to relax and manage the stress is very important. You can go for meditation, you can go for yoga, you can spend some time with yourself for some time, read good books, go to sleep, have a good sleep. That is also very important. In the night, people are watching all mobiles, videos, and movies. So avoid the night-long, overnight watching of videos and all this. Try to have a good sleep. That is also very important. If you have disturbed sleep, your blood pressure will rise invariably. Now with the medicine. If you are prescribed medicine by a doctor, please continue the medicine unless the doctor stops it. With the medicine, if you check your blood pressure anywhere, it will be normal. That doesn't mean you have to stop the medicine. You should continue the medicine as prescribed by the doctor. When you are ill, like high fever, diarrhea, vomiting, and all this, you can stop the medicine for 1 or 2 days, but don't stop it for longer time. So consult your doctor and then stop the medicine. So all the people try to stop the medicine. So I'm feeling well, my blood pressure is okay, so now stop the medicine. That is a very wrong. These people come with the stroke, heart attack, and all this stuff. So don't stop the medicine when you are prescribed the medicine by a doctor. Always stop the medicine when the doctors will ask you to stop it. So at last, I would like to suggest that there is nothing more precious than having a fit and healthy life. Adapting healthy lifestyle can help us to enjoy a long and healthy life. High blood pressure can be prevented as well as controlled. In every ways, keeping blood pressure in the normal range is very important in preventing all cardiac, cerebral, or renal, or eye complications. So it is very much possible to maintain a normal blood pressure level with a regular monitoring and all these preventive measures. Thank you very much.